November is Lung Cancer Awareness Month. UMKC Health Sciences District is teaming up to talk about the importance of early detection. We have Dr. Gary Salzman, who is from Truman Medical Centers, and also Dr. Justin Stowell, who is a resident physician in training at the UMKC School of Medicine. And guys, we are talking about lung cancer, and you were sharing some statistics with me about lung cancer I did not know.
Absolutely. A lot of people don't know that more people die of lung cancer than breast cancer, colon cancer, and prostate cancer combined.
That's pretty incredible. So we're talking about hundreds of thousands of deaths a year from lung cancer.
Correct. About 150,000 deaths in the United States from lung cancer, yes.
So we want to prevent this. Give us some ideas on how we can do that. What's the screening that we're talking about?
Just in 2014, the United States Preventative Services Task Force looked at the available data and recommended official low-dose chest CT screening for high-risk smokers or former smokers. They should have a 30-pack-year smoking history and should be asymptomatic of lung cancer. So also, if you're a former smoker, you should have quit within the last 15 years. But if you meet any of these eligibility criteria, you can be screened for lung cancer for early detection.
So a 37-a-year pack a day.
30-pack-year smoking history.
30
that
packs
means
a year.
1 pack per day for 30 years of smoking or the equivalent.
Okay. All right. So those people should go and get screened before they even have symptoms.
Correct. That's the whole goal of lung cancer screening is, unfortunately, in the past and currently, lung cancer is diagnosed at stage 4 at the time the patient presents to us for care. They come in with symptoms, and at that point, there's really no treatment available for them that will prolong life. We have now shown that with screening, we can detect these cancers at their earliest stage when they're sometimes less than a centimeter in size and give them a curative treatment at that point. And these patients have, 70 to 80% survival from this.
Wow, that's really an incredible survival rate from where it was before. Okay. So we're trying to jump ahead of the game to try to get to them before. Research shows this is going to be effective. It's going to work. What do we say to people?
Absolutely. If you are a smoker and you're between the ages of 55 and 80, you need to talk to your primary care doctor about getting lung cancer screening. And it's a simple X-ray. It's a low-dose CAT scan. The radiation is a low dose, and we have shown that those people that are diagnosed early have stage 1 lung cancer that's curable instead of waiting for symptoms and have stage 4 cancer, which is not curable.
Now, what do we do in terms of going in to get screened? I mean, do we just call our regular physician? I mean, is this a special thing that's only available a certain place?
You need to talk to your primary care physician, because another component of this is to talk about quitting smoking, because that's an important part of this. But you need to talk to your primary care physician, and then the physician would have to order the lung cancer screening that we do at Truman Medical Center, and that patients can get the screening. And we have a whole multidisciplinary team that follows patients from screening to diagnosis to treatment. So it is important to start with your own primary care physician.
All right, we've got to talk a couple of, just mention at least 3 or 4 top symptoms of people who may have lung cancer and not realize it. Of course, we're talking about screening, but also...
So the symptoms would be coughing up blood, would be shortness of breath, would be pain, like taking a deep breath and having pain, weight loss. Those are some of the symptoms. But unfortunately, a lot of times, by the time those symptoms arise, the patient already has stage 4 lung cancer. That's why we want to screen people before they have symptoms if they are smokers and are high risk.
All right. Excellent, excellent advice. Both of you, thank you so much for coming and sharing on Lung Cancer Awareness Month. New screening. Get out there and get screened and get ahead of the game so you have much higher chance of survival. Thanks for coming.
Thank you.
Thank you.